Share screen. Here we go. Okay, so y'all should just see a big slide now as it says objectives. Okay, so today we're going to be talking about things that not only are going to make you successful in your career as a PTA, but things that are going to make you successful in life, no matter what type of profession you choose to go into. Even if you say after you got out of PT school or out of PTA school, and then you're like, you know what, I think I want to do something different. Which hopefully, I hope none of you are going to do that. I hope you all are set and pretty much set on what you're going to do. But that's okay if that happens. It happens, and then I hope you could take these same career attributes that we've been sharing with you the last couple of weeks, and you can apply it to any career. So like how we've been talking about like the APTA code of ethics, and then we talked about things about the ADA and laws with disabilities. I mean, you can take that into any career with you. Okay, so successful people. So let's talk about attributes of successful people. Okay, so now this is attributes of successful people in their career, but successful people in their life as a whole too. Okay, so not just in your career. Now we're focusing all what I have on this PowerPoint is in your career, but also this can also be as your attributes of a successful person too, just in their everyday life. So number one, you want to be optimistic. With your patients, we're gonna, some of you, depending on well, all of us at one time or another, we're all gonna work in different settings. Some of us are gonna work together. Some of us are gonna move away. Everybody's gonna find their own niche they like to treat into and treat in certain types of patients. Some of you will be generalists, which we need all those types of therapists. But sometimes we're going to see things that just are really, really sad. Sometimes you're going to say if you work with patients with a traumatic brain injury and they've had a lot of skull trauma and they've had to have part of their brain removed, and it happens, they've had to have part of their lobe removed, and then they've got they have to have their skull reconstructed, and then they have to learn how to walk again, how to talk again, how to eat again, how to speak again. I mean, it's a long road. I mean, I've worked with several patients just like that. And sometimes you have to learn how to be optimistic with those people. And yeah, I gave you a really, really like worst case scenario example of a patient you might run into. And yeah, that is a pretty bad scenario, but you have to learn to look on the bright side, and and for people like that, you look for little bitty, what's the word I'm trying to say? Little and small little victories every day lead to progress. So if somebody learns how to hold their head up for a minute before they lose head control, if they're working on head strength and they're working on holding their head up and sitting, and then they can make it a whole minute before they just can't hold it up any longer. You have to celebrate those little bitty victories with people. If somebody can get their first word out and after their injury or stroke, you have to celebrate those victories and little things like that. Now I'm giving you worst case scenario. Now, other times most of the time we're going to be with people that are going to have much less involved in injuries, and they're going to be a little bit down about it, but we have to be cheerleaders for them. We have to always look on the positive side, even if we know they have a lot of comorbidities and things working against them in their healing. We have to try to stay positive and do everything we can do to get them through this. Okay, commitment. Number two, no one sets out to do a job poorly. Okay, so and we've talked about this in many different lessons and in different contexts, but just basically with every patient, try to give 100% of yourself to your patient. Try not to just be like, well, it's Friday and I've had a hard week and I'm not really feeling it today. So I'm just going to do some really easy things with all my patients today because I don't feel like physically working and I don't feel like mentally working either. I'm just going to keep it easy for all my patients. They'll never know the difference. Well, that's not really setting out to do a good job. You're not committing yourself 100% to your patient. Um, So you need to set out to do every single treatment session with 100% of your ability and with 100% of a good attitude. In life, if you were doing something that is for personal growth, you would never set out to do to if it's for you to advance in something, or let's say if it was you in therapy, you wouldn't want your therapist to just do the bare minimum. You would want them to do 100% for you so you could get better and you could get back to your life. Okay. Number three, passion. You have to have a passion for this job and for what you do. So no matter what field you of lot of occupation you go into, it's really important to have a true passion for that job because if you don't, every day is going to feel like just a long just job that you're just going into to get a paycheck. So, whenever it's right now, you probably have a lot of curiosity and passion as a student because you want to learn about new diagnoses and you want to learn how to help people get better. And especially when you go on your clinicals, you'll have a lot of feelings of excitement and joy and wonder and like seeing new diagnoses and seeing new things and new techniques you've never seen. That's the kind of passion that you want to have as a student. And hopefully that passion will never go away as long as you work. Now, that passion may change and you may develop a passion for one certain type of patients or one certain type of technique. That's okay too. That's a developing another type of passion. But for whatever you develop doing and working in for the majority of your profession, you want to have your heart into it. When we say passion, you want it to be coming from your heart. Okay. This is not just something you're doing for a paycheck. This needs to be something for that you're doing from not just your brain and not just as a healthcare provider, but for help. You want to make a difference in somebody's life. Okay. Competence. Well, hopefully you'll all make it, all of you will make it through this program. We have faith that all three of you will. And if you graduate, you will and pass your boards, then you will be deemed to have entry level competence as a physical therapy practitioner, as a physical therapy assistant. And that means that you have the basic skills and what you'll be called entry level. And that when you start looking for jobs, you'll be looking for jobs that say new grads welcome or entry level physical therapy assistant job. That means grads straight out of school or that have just graduated or graduated within the last few months or years. Um, well, you'll all have a basic competence, but let's look down at this last bullet down here. I'm not going to read all this to you, but look at the last bullet. It's very, very important. Lifelong learning is an important component and will help all, not just PTAs, but PTs become more successful in patient care. So we have to have continued competence in our profession. So that's one reason why you have to get a basic number of continuing education units and hours every 2 years to keep your license current. So um, our licensing agency keeps us at least somewhat competent and at least somewhat accountable to that. But still, we should not be doing just the basic amount of work to keep our CEUs up to date. No, yes, I won't lie. CEUs can be expensive. And, if a lot of employers give you an allowance for CEUs every year, and that's really, really good. Some employers pay for all of it. Some of it will pay for half of it. Some of it will pay for each course. They have to look at the objectives and they'll agree to pay for all of it or some of it or things like that. So, I know that courses can get expensive and everything like that, but there's lots of things that you can do for free. So if you're a member of the APTA, you get journals every month, you get magazines from them every month. They're just like regular like workout magazines, fitness magazines from that are PT related, lots of different things to help you keep up to date with what's going on in our profession. So there's many ways you can do that. Taking weekend specialization courses for special techniques in our profession, or even if you choose to advance your career and go back to school and get another degree, that's good too. Any of that. Initiative. So we always want, whenever we always look for in our program, as semesters go by, we're always looking for the students that have really good initiative. Those you have really good, if you don't not familiar with that word, initiative is doing more than what is expected of you and having the drive to do it yourself. So you don't have to have somebody always on your back telling you, okay, you got to get this assignment done, you got to get this done. Or at work, you don't want your boss to be saying, okay, your patient's here, you got in the waiting room, you got to go up there and get them, come on, let's go. You want to always be doing more than what's expected of you. Okay, so in school you always want to be working on assignments early, because we have found the students that have work on assignments early, when they can, they tend to come to us and ask questions about it before they turn in the final assignment. And then if they have asked questions about it, us to clarify things, they may tend to make a better grade than somebody that just went out on their own and didn't clarify questions. Maybe they had some questions that wasn't clear, but they were like, well, I'm still just going to go about this and just figure it out on myself. Or with patience, let's go back to that passion and that commitment we talked about. You always want to do with your patient, you always want to do at least the bare minimum, but you always want to try to do more than what is expected of you. Try to do more with the bare minimum with a patient. Okay. And think about if you were the patient, you would want, and let's say that you were a patient and you were bedbound, or if you were a home health patient, you would want your therapist to do not just the bare minimum. You would want them to go above and beyond what is expected of them. And those are the therapists that have good outcomes. Those therapists that go above and beyond the basics. Those are the therapists that have good outcomes, and those are the therapists that are talked about and have good reputations in the community and network really, really well and get good referrals. Flexibility. Okay, this is not just for our profession, but this is for any profession and just really just life in general. You want to be flexible. You can't be a concrete thinker. Healthcare laws and healthcare laws are changing all the time. Insurance and Medicare laws change almost every year. So there's constantly things that are changing about what we can and what we can't do, and how long we can do things, and how short some sessions have to be, and how they might put a time cap or a dollar cap sometimes. It changes every year, every couple of years. I mean, especially for Medicare, not so much for private insurance, but for Medicare and Medicaid, it's a constant, just the laws always change, and there are always stupid changes. If you ask any healthcare worker, but these are just politicians that have no healthcare experience making these laws. But that's my soapbox. Anyway, you want to be flexible on the job. Sometimes patients are going to be 10 minutes late, or sometimes a patient is going to call you and say, hey, they're going to call you 5 minutes before they're supposed to show up, and they're going to say, hey, I'm not going to be able to make it today. Well, that's irresponsible on their part to call or be a no-show, but you've got to be flexible. So if you have a patient booked and you're working outpatient in a clinic, and you've got a patient booked to see them for an hour, and then you have another patient that shows up 30 minutes early on by mistake, or an hour early by mistake, thinking that their appointment was earlier. Well, you've got to be flexible, and you would never want to make a patient wait in a waiting room or wait on their treatment for just because they're early. You want to try to do something to work them in, because that's not just being a good healthcare provider and a good worker, that's good customer service too. If you make them wait until you're done with that other patient for a full hour, they're probably not going to be very happy with you. Now, yes, you have to provide one-on-one care to each of your patients, but maybe you could do some of those things. Maybe you could set them up with another therapist or somebody that's got some paperwork time. Say, hey, can you get this patient, my second patient is early, can you set them up on this exercise for me while I get so and so started on this exercise, and then I'll bounce back and forth. And then maybe you could group them together and do some work as together and pair them up and do some group work, things like that. You can get creative in how things like that go. You just have to be flexible in your job. Or if also it happens at every job, somebody wakes up in the morning, a employee doesn't feel well, calls in sick. So we can't just, it's not really good customer service if we can help it to cancel their patients for the whole day. Let's see if we can rearrange our schedules to absorb their patients for the day, or do the absorb the most we can for the day. Now, if we're a small clinic, we might have to cancel them. If we're larger, those are better able to absorb a full schedule. So just being flexible on your job. Number 7, attributes of a successful person: generosity. I always want to be generous. Um, always show gratitude toward others. Not this is now your patient. You do want your patients to show we do expect a little bit of gratitude from our patients, but in the end, this is our job and our profession, and we are getting paid for it. So they're all going to thank us for helping them, but in the end, they're all going to say, what can I do? I can never thank you enough. And your patients are going to try to give you money. They're going to try to give you gift cards. They're going to try to give you food. They're going to try to give you gifts. Sometimes we're not able to accept any of that as clinicians. So we have to show gratitude and generosity by saying, hey, that's just the bare minimum. That's my job. I'm happy to do it. I can't accept this gift, but we can always say, it was my pleasure in helping you achieve these goals. And, I feel very much a part, like, of you getting on with your life, and I think that's great. So I'm excited to celebrate this with you. If they give you food, like if they just bring in cakes or cookies, don't just take it for yourself. Say, well, I can't accept this for myself, but can I but I'll share it with the whole office. And then you can put it in like the break room or the kitchen, and then it's for everybody. But you can never accept any kind of monetary gift. Showing generosity to doing things like pro bono clinics. Pro bono, if you don't know what it means, it's a legal term, and that means doing something, providing your services for free. So there might be some certain community clinics where they do certain therapy services for, like, on certain days of the month for free. We have a clinic, well, it's not a clinic, it's a service called RSVP. I think it stands for Rehab Services Volunteer Professionals. It's made up of PTs, OTs, speech therapists, wheelchair vendors, doctors, all kinds of social workers, nurses, all kinds of healthcare providers, and they all get together on a couple weeks, Saturdays a month, at different locations around Houston, and they provide their services for anybody that needs it that doesn't have health insurance. So, you may not think that one PT session will do much work, but maybe you treat that session as, okay, well, this person has this disability, and maybe I'm not going to be able to get a lot done with them in one session, but I can give them a good exercise program to take home with them to help in their daily life and get them through some of these things and make them a little bit better. Or maybe as a PTA, you would meet somebody and you could educate them on pressure relief in their wheelchair. And, this wouldn't be a formal therapy session, and this wouldn't be something that you would need a doctor's prescription for. This would be kind of like a working at some kind of charity service, and we're just working with people that don't have resources, and we're educating them on diet, educating them on, you could educate them on just daily mobility and they're in old age, certain balance exercises, educate them on assistive devices. Maybe people could be there to fit them with devices, and maybe you could assist them and train them on how to use a cane or train them how to use a wheelchair properly, things like that. Those are pro bono things, and those are things that we can all do, and we can do things through all kinds of charity events that are offered, volunteer events. And there's usually no doctor involved in those. They're usually just run by community services and events and things like that. Our relationships. So we need to develop a good relation. Well, let's start off with you guys as PTA students. You guys need to develop a good relationship with each other, because building relationships with those that are in your profession is really, really important, and you don't really see the value in it until you're put in those shoes. So, when I was going through my undergrad, I didn't really have to make a lot of study groups and really didn't have to develop really deep relationships with people I was in class with. I just had my friends that I hung out with. But then when I got in PT school, I was with the same 40 people all day long from 8 to 5, Monday through Friday, sometimes Saturday, for 2.5 years. You think that we got close? Yes, we got very close. We were in class together, we studied outside of class together, we worked out together, because all of our schedules were the same. We had the same class times schedules, we had the same lab times, we had the same break times. So we got really, really close. Well, I'm not saying that y'all have to become best friends, but if you build good relationships with your classmates, that helps you become better study partners. Because when you develop good relationships with each other, you start understanding how people think, and you want to study with those people. You don't want to study with people, and this might sound opposite to some of you. You don't want to study with people that just think exactly like you. You want to find people that think differently than you. Now, you don't want to study with people that are thinking so differently than you that they're always wrong. Now, that's not what I'm saying. Now, you want to find somebody that maybe understands everything right, and they come to this and they understand the concepts of the class like you do, but maybe they understand it a different way, or their way of coming to the same answer is a little bit different than you. Those are good ways of studying, because those are how board questions are going to be thrown at you. Those are how future semester questions in this program are going to be thrown at you. It's not always going to be black and white questions like they were this semester. They're going to be scenario based. They're going to make you think, and you're going to have to think on the spot. So you're going to have to think different ways in this profession. So not just to get through this program, but in this profession too, because just when you think you've seen, and I'm just gonna, well, I'm getting off topic, but another work relationship, I'm getting way off topic. You need to have good working relationships with the doctors that refer to you, because if you have good relationships with them, they're gonna happen to refer to your clinic more often. And yes, they have to refer to the PT first to do the eval, but if they know, like before I left here, there was a PTA that I worked with and he personally had multiple sclerosis, but he was in the early stages of it. Well, he set it upon himself to become a MS specialist to treat those types of people. He got all kind of certifications in MS treatment and stuff. And Tier marketed him as an MS specialist. And even though he was a PTA, all these neurologists and neurosurgeons started sending us all these MS patients, like this flock of MS patients before. And they say after evaluation, please have patient be seen by PTAs. I can't say his name online, but they were requesting that PTA. So even as a PTA, you can develop a reputation with physicians. You especially develop a reputation with other PTs, because if other PTs see that you're a good therapist, they're going to trust you more. They're not going to be looking over your shoulder. They're not going to be reading every single word of your note to make sure that you didn't mess up on something. They're going to trust you. And then eventually you'll almost be like, they'll see you as equals. And that's almost how, with the PTA that I worked with, I was talking about, that became the MS specialist. I didn't really see him as a PTA. I saw him as just an equal, because he was an MS specialist. He knew a lot more about MS treatment than I did. So, there were several times when I had patients that would cancel or that would no show. And I would ask him if I could hang out with him while he treated his patients, just to learn from him. Because he knew a lot more about it than I did. So that's developed, that we had a good working relationship. So, you want to have a good working relationship with your PT, so they'll want to learn from you too and see you as on an equal playing field. Networking. So networking is something that we're probably all not gonna be the best at if this is your first career. I know I jumped into PT right out of college, and so I've never really got a good business class, but you'll learn a little bit about. You'll have your own little business class in semester 5, and Dr. K does a really good job in that class. He'll teach you a lot about networking. um, when you don't only want to network right now with other PTA students at other schools, but you're going to network with other clinicians too, because on these meetings that we're telling you all that we have set up, the SED meetings, that our local TPTA monthly meetings that you all have to go to, a couple of them by the time you graduate. That's a networking opportunity. And I'll be honest with y'all, the majority of all the attendees of those meetings are students. They're DPT students, and they're PTA students, because we've got a lot of programs of y'all around the Houston area, and they all attend these meetings. And so they all come together, and they all mix together and talk about their schools, what this school does, what that school does, and just what's different among their programs. But you also get to meet different clinicians that are out there in the community. And if you want to meet a clinician that's a specialist in this, and you just want to bounce a few ideas off of them, that's what they're there for. And they love students asking them stuff like that. So right now, a lot of those things are done virtually, but they're still running the same way. Like, clinicians are there for students and other people to ask them questions, if they want to, ask, well, what is it like working in this field? Or you have any future openings at your clinic? I'm going to graduate in a few months. Y'all might could, plant that little seed in their head. I'm looking for a job in this field. Which, got any openings, or you foresee any openings? Things like that. Setting career goals for yourself, always having a goal in mind. Never try to stay status quo and just think, I'm happy with the way the way I'm doing things, and I'm just going to keep doing them that way forever. You always want to try to be improving on yourself. Just as a student, you always want to be improving in yourself in your career. And even if that means I just want my communication with my patient to be better, and give yourself a, say, 6 months, and say, from 6 months from now, I want to be communicating better with my patients, having to repeat myself less, having better, or maybe your career goal is, I want to be specialized in this certain type of treatment in 2 years, and your goal that contains going to certain continued education classes and getting a certification, something like that. Or I want to just get 2 years of experience in lymphedema management before I decide if I want to work in cancer rehab. That's a goal. They all can be personal goals. They don't have to be, goals written down with your own boss. They can be personal goals too. They can be little things, personal things, or they can be real academic or career things. And we talked about all these things. So continued competence. Does anybody remember how often do y'all have to renew your license as PTAs?
Every 2 years, right?
Every 2 years. And how many hours of continuing education do you have to get?
I think it's 12, right?
Not 12. Anybody know? This may be the point where I teach you this. Just thought somebody might know. For PTAs, it's 20 hours. So don't be fooled by that number of hours. Is actually a little bit more that you spend in 20 hours, but every continuing education course that you go to, you always have to look and see that it's been verified by the Texas board to be a certain to be a certified continuing education class. And it will every course is given a certain amount of credit. So like for usually courses are good for like if you go to a class it's like an all day 1 day class, even though you're there from like 8 to 4, 8 to 5, it might be good for like 6 hours or 7 hours of credit. And that doesn't matter whether it's all lecture or all hands-on or half and half or what have you. If you go to a weekend course, you might knock out 12 or 15 hours and get almost all your hours out of just one weekend. But every 2 years before your license expires, you have to you have to accumulate 20 hours of continuing education that are deemed appropriate by the Texas board. Now, there's a lot of things you can do. There's a lot of live classes that are always coming to Texas. The Memorial Hermann is always hosting courses for anybody who wants to go. Texas Children host a lot of big famous courses. Methodist host a lot of big famous courses, and they open it up for their employees, but also for outside people too. So you can go to a lot of cool big certification courses through them. Sometimes courses will be done sponsored by like a certain clinic will sponsor a course, and they'll sponsor they'll sponsor it over a few weekends, things like that. Different ways. There's also you can get CEUs over online too. They're like recorded lectures, and then you have to take a test or to get the credit for taking it. And that's become big during that's become big during the pandemic, with people not able to go to his live courses. But live courses are starting to come back as people are starting to get vaccinated and stuff. So a lot of hands-on courses weren't able to be given during the last year or so, but they're coming back now. Was there a question?
Ms. Allen, I'm sorry. When we graduate, will we have a full 2 years for our CEUs, or will we have to take them a year after we graduate?
No, when you graduate and when you take your boards, you have 2 years. Your license is from the day your license is signed and deemed like your license. You have 2 years from that date to renew again. So in that 2 years, you have to accumulate 20 hours before the 2 years is up. You don't have to get 20 hours before your first license. It's just 20 hours before you have to renew. Does that answer your question?
Yes, well, I was wondering, I mean, does that go from the day we graduate or the day that we do our or not the NCLEX, the licensure?
The licensing exam. And it's
Okay.
not the day you do the exam, it's the day the Texas board takes your score. It might be, which is usually just a few days or a week later, looks at your score and basically says, yes, they passed. They have a license now. And then they put it online, or no, they don't have a license now. But it's basically from the day they issue your license until it runs out.
Yes, sir. Thank you.
And the way they do, and it hasn't always been like this, but they just changed the law. Now the expiration dates for the licenses is always on the month of your birthday. So when y'all take your examination and when you pass it and get your license, some of you may, it depends on the time of year y'all graduate and take your license, and then when your birthday is. Some of you may have a full 2 years of your license before your birthday comes around and you have to renew. Some of you may have less than 2 years. You may have like a year and a half before your birthday rolls around. But it used to always be from the time the license was given, but now they do it by birthdays, because there were so many people that would always forget to renew their license for like a few days and then have to pay a penalty for treating on an expired license. They just made it easier and just made it everybody's birthday month to make it easier to remember.
What if your birthday is like a month after you take your exam?
I think if it's less than a year, they prorate the cost or something of the license, or they do something like that. I'm pretty sure. I've never heard of anybody getting screwed over with something like that. Yeah, don't worry about that. I would never imagine that would happen.
I was just trying to figure out if we had to like coordinate with our birthdays to take the test.
No, you shouldn't have to. Don't worry about that. No, you shouldn't have to. Leadership, I mean, leadership is something that some people are born good leaders. Some people are born followers, but in our profession, as a PTA, we do, even if you're not you don't feel like you have very strong leadership skills, we at least want you to feel like when you're working, that you have strong leadership skills in the area that you're treating. So if you're working in mostly home health, we feel like we want you to feel like you could take a less experienced home health PTA and train them in home health to get them up to speed. Or say if you were a PTA that was working in aquatics, and then there's a DPT that was hired at your facility that's never done aquatics before, and now they're going to work full-time at your at your facility. Well, you're going to show leadership, because even though you're the PTA, you may be in charge of training that DPT therapist on how to do aquatic exercises, how to do aquatic programs and things like that. Even though you're not treating patients over them, you may be teaching them how to do the exercises. That's totally appropriate. You would be a leader in that case. If you're teaching if you do an in-service in your clinic say you go to, you get certified in a certain manual technique, or dry needling, or certain manual skills, and you want to come back and teach your clinic, which usually if you go and get certified in those things, one of the stipulations a clinic will make will be, you have to train us on what you learn. So you'll go, and let's say if it's on joint mobilizations, so you'll come back and you'll put together an hour in service, and you'll teach everybody in your clinic, everybody that works there, the therapist and the assistants, how to do the joint mobilizations that you learned. And maybe you can't teach everything you learned, so maybe you do an hour of just upper extremity and then an hour of lower extremity, and like a week later, or you break it up over time until you've taught them all those things. and they'll be doing the same thing to you. That's how you're all leaders with each other.
Mr. Allen, I have a question, sorry.
Yes.
How soon after graduating are we able to sit for the boards?
You're not listening to anything else I'm saying.
I know, I'm sorry, I tried.
Y'all, I know. I didn't mean to scare y'all about that. No, it's actually it's very weird. It's always been changing. So when I graduated in 2005 from PT school, you could take the boards anytime you wanted to. You just had to sign up to do it, and then you just took it basically a week after the testing center got your money and registration. You could take it year round. Then they changed it to 4 times a year for PTs and PTAs. So it was only given every 3 months. And that's how it's been for like the last few years. Then when the pandemic hit, you still have to go to the testing center, but they're doing it, they're stretching it out over the whole year. But it's like only certain numbers of people can go to the testing center every week and take the test. So, you know, like when you graduate and we send in the information for this last cohort, some of them got to take it immediately. Some of them had to wait 6 weeks. Some of them had to wait 8 weeks. It was like that, something like that. It's not a long time, but that's just for the pandemic. Now, by the time y'all are done, remember y'all are in semester 5. We've got vaccines out now. You're supposed to have we're all supposed to have at least have our first vaccine by May, hopefully. So hopefully things are going to be a lot more normal by the time y'all graduate and we'll be back on campus. And then the testing things will be back to normal then. So who knows, really? I can't tell you. So sorry, I don't have an answer to your question.
Answered it. I was just wondering, like, generally what it's been like or how it usually goes. So
Yeah, it's usually, you mean the testing schedule?
yes, just like the how the structure is basically after graduating, how you can go.
That I don't know why I don't know. When I graduated, anybody could take these tests anytime they wanted to, and then they changed it to 4 times a year. And then now during COVID, it's staggered. Like it's like they just let people take it all year round, but it's like only like 1 or 2 people per testing center per week because of COVID restrictions and stuff like that. So, but by the time I graduate, it'll probably be a lot different. So who knows? We don't know. I will let y'all read all this fine print. And that is it. So maybe you learned something new today, but mostly I just learned it was mostly common sense things, how to be effective in life. So even and we talked a little bit about networking, even though y'all are in your first semester now, you know, go ahead and start trying to go to some of these SED meetings or try to meet some clinicians in the community, or if you ever come across somebody that is working in an area that you might be interested in, even if they're an OT or an OT student, or if they're a speech therapist, or even if they're a nurse or doctor, but they work in an area that you've thought about that you think is interesting, just, you know, that's a way you can even as a student start networking and getting your interest out there and getting your name out there. You know, if you have a LinkedIn account, you know, start a LinkedIn account and just put, you know, you're not a therapist right now. Don't lie and say you're a PTA, but say current physical therapy assistant student at Pima Medical Institute. If people see that, I mean, recruiters might see that and save your information and bring it back up one day. You never know. So you don't know what's going to happen. So you start networking out there now. Okay, so I did send y'all an announcement on Friday. There is a quiz that is going to be opening for this afternoon. I think it should be open now unless the daylight savings thing changed. If somebody would go into it, see if you can get into it now and let me know if you can.
Do we have to take it on Respondus or just regular Blackboard?
It's not on Respondus.
Okay.
Mr. Allen,
Yes.
I know there's an open lab on Thursday. Is there a way that you could possibly open one like Friday morning?
I am gonna not, Miss King and I are both off on Thursday and Friday. So there's the only people that can manage open lab this week is gonna be Dr. K and Dr. D. So you would
Okay.
have to, is the only one y'all have scheduled for this week on Thursday?
I believe so.
Okay, so y'all are gonna have to get with them, one of them, if y'all want it on Friday. They might not, Dr. K usually doesn't mind doing that extra on Friday, and Dr. D's usually there anyway, and she'll just open it up for y'all, but y'all are gonna have to ask them for that.
Okay,
Yeah,
thank you.
yeah, so,
Is it in its own file or is it in one of the like assignment folders or something?
it's
Because it's
under
not.
assignments, and it's labeled quiz 3 or quiz.
It's not
I
on
don't
here.
see it in there.
It could be because you
Well-
said it was starting at 12 and it's 11:50.
Wow, y'all know how to work Blackboard better than me, it looks like. Okay, well, I'll take care of that while I am online with y'all. But while I'm getting that done, any other questions? This is just a 10-question quiz. Let's see how I can do this. Oh, I go to the control center. Ah, that's one. That should take care of it. And you should be able to get into it now.
Yeah, it's on there. It's just, it's its own section, so it's not in the assignments anymore.
Oh, it's on section. Okay, it's on quizzes. Okay, y'all, it's there. So y'all may leave and start your quiz. It's only 10 questions, but it's time. So don't spend too much time looking up the answers, but it's over all the stuff we went over from the last few lectures, okay, since the last test, okay? All
Thank
right,
you.
good luck.
All right,
Oh,
thank you, Mr. Allen, and have a good break, and happy
Thank
early
you.
birthday or
Thank
belated.
you very much.
Yeah, happy birthday.
Thank
Happy
you.
birthday.
Thank you. You'll still send me on Wednesday so you can bring me a gift.